A very good morning, everyone. A warm welcome to the launch of the VSP Academy of Interventional Cardiology, CHIPS CTO PCI at CARE Hospitals, Banjara Hills. I am Divya Koti, Manager for Learning and Development at CARE Hospitals, and will be your Master of Ceremony for today. On this special day, we are here to witness at the launch of the first of its kind VSP Academy of Interventional Cardiology that is being started with a visionary thought of exploring, interacting, and sharing the knowledge of PCI by Dr. V. Surya Prakash Rao Garu. I humbly welcome our chief guest, Sri Sunil Sharma, IAS, Special Chief Secretary, Government of Telangana Energy Department. Sir, over to Dayas, please. It's my honor to introduce our guest of honors, Dr. P.C. Rath, President, Cardiology Society of India. He is a distinguished international cardiologist with 30 years of experience, currently serving as the head of cardiology at Apollo Hospitals, Jubilee Hills. Notably, he holds the prestigious position of National President of the Cardiological Society of India, underscoring his leadership and contributions to the field of cardiology on a national scale. Now I would like to introduce Dr. V.S. Ramchandra Garu, President, Telangana State Chapter CSI. He is a highly skilled electrophysiology specialist with a vast portfolio encompassing thousands of electrophysiology studies, radiofrequency ablations, pacemaker insertions, and many more. Now I would like to welcome Dr. Rajgopal Raju Garu, Senior Consultant, Cardiologist, CARE Hospitals. Dr. Alluri Rajgopal Rajgaru holds the distinguished position of Professor of Cardiology within the CARE Group, having been associated with CARE Hospital since inception. Now, I also extend a warm welcome to Professor B.K. Sastri Garu, Senior Consultant Cardiologist, CARE Hospitals. He is a distinguished figure in the field of cardiology, renowned for his accomplishments as an academician and interventional cardiologist. We welcome you all, sir. I also welcome Dr. Nikhil Mathur Garu, Group's Chief of Medical Services, CARE Hospitals, to come onto the dais. We welcome you, sir. I also invite Dr. VSP, sir, to come onto the dais. We welcome you, sir. While we remain standing, let us all begin the program with Saraswati Vandanam. I request everyone to please stand. May I request our chief guest, Sri Shunil Sarma Garu, and guest of honors to come for the traditional lamp lighting. I also request our Hospital Chief Operating Officer, Mr. Nilesh Gupta sir, to join the guests. Thank you, everyone. I now request Dr. Priyan Kantilal Shah, Consultant, Department of Cardiology, to enlighten us about the VSP Academy and introduce Dr. V. Surya Prakash Rao Garu.
Yeah, good morning to all dignitaries, faculties, guests, and delegates. With a great joy and immense exultation, I feel privileged to extend a warm welcome to all present here and on the live webinar for the launch of the VSP Academy of PCI. Being associated with Dr. V. Suryaprakash Rao for more than 2 decades, it is my honor and privilege to introduce him to you all. I would like to share some thoughts with you all in very simple words, like he inculcated how to achieve a goal, be focused, how to learn, understand, and acquire knowledge, and implement in fulfilling the responsibilities towards the patient with utmost care and caring, and accountability in answering to the society, and many more. His personal touch for every patient is unparalleled for his decision and caregiving recommendations. I will not take much because there is a long list which is endless. So with this short note, we look back how his adventure have started, and he is proctoring across India for the CTO PCI with vision, commitment, and dedication. And today the launch of the VSP Academy, the VSP. Can we have that short video? Please run, no? మీ దగ్గర అది ఉంటే some volume to be given. Over the last 25 years, we are working together. He has engineered 2 major platforms of interventions, that is complex angioplasty and chronic total occlusion, and the founder member for the Indo-Japanese CTO Club, which is now one of the major platform for the South Asian countries. And we had been doing regular live case transmissions annually all across the globe. To his credentials, he had been given a lot of live cases to US, in European countries, and to Japanese areas. He is one of the only Indian cardiologists to serve as an cath lab advisor in the Japanese cath lab. During these 2 years of lockdown, a lot of webinars, and he had been able to spread out the techniques and live cases through live webinar also, and interacted with very important interventional people across the globe. To his credit also, he was one of the first cardiologists to give the LVAD in AP state. He had been honored by many organizations and by the NGOs, including the Tamil Nadu State CSI. Thank you.
Thank you, Doctor, for the quick brief. May I request Dr. Surya Prakash Rao Garu, Senior Interventional Cardiologist, to speak about the program.
Slides. First of all, I welcome the chief guest, Sri Sharma Garu. I know how busy in the government bureaucratic issues, spending time and all over coming and blessing us, and that's a great thing. My gratitude to him first. Second, my seniors, my professors, and Dr. Rajgopal Raju, since Nizam's days, and how he has taught us the basics. Then we have grown to this stage because of the professors working behind and pushing us to learn. And Dr. B.K. Shastri, my contemporary professor, very good academician. And Dr. Rath, a very good friend, my senior, and very nice personality, immediately accepted. He is very busy as a national CSI president. And Dr. Ramchandra is my colleague, and he is an electrophysiology. He was in my team sometime. Now he's the owner of with the holistic ideas. He formed a beautiful hospital and performing very nicely, doing good, generous work to the poor people. And Dr. Nikhil and Dr. Nilesh, the administration side, who have supported me all these years and still encouraging me to do many more things. Without their support, it would not possible. And my colleagues and many people likely to join now with this session with because I proctored many places in India and abroad. Instead of going there and teaching, these are long procedures. So I thought because form a academy instead, then invite them all to share the views. That's the reason I formed this, and many more to join today with the 6 cases we posted today and tomorrow. They're all highly complex cases. I got the slides too. So this is actually today, my journey in interventional cardiology was ignited when I witnessed a live CTO case in Paris in 1999, when Professor Saito is doing the case in the midnight 12 o'clock because of in Paris, this show. I'm sitting in the last chair and watching it. That time I thought whether I can reach some stage in my life, I can at least watch these things from a close angle. It took me nearly almost 2016, 15, I started this journey of doing aggressive interventions. Almost it took me nearly 15, 16 years of hard work. And my association with Japanese goes almost from 18 years. So I'm called there as Dr. Rao in many of the cities of the Japan. And I formed this experience actually kindled my passion to become a proficient CTO, not only very complex operations without sending for surgery. So I have formed in 2006 one organization called CACTO, where a complex PCA in CTO can be done. In 2006, that is one of the best 350 cardiologists attend when I am working in a different hospital. Maybe the first big platform in the country. And again, every cardiologist, senior cardiologist, including Dr. Matthews, the PAB Mehta, Ashok, everybody joined that meeting and they have also done the cases along with us. And that started the journey. And then I thought we should not limit to this. Then I formed directors all over India. And then with the Japanese association, I made one form called Indo-Japanese CTO Club, where we used to every year do in one city, roughly around 700 cardiologists used to attend from all over the world, from Asia, Europe, US, Asia Pacific countries. And that became very popular nowadays. And we train many fellows by doing a toughest, maybe some of the toughest cases in these forums. And then I thought I used to travel as a proctor to many of the centers doing the complex cases. Next slide, please. Next slide, please. So actually today, all this credit goes to my father. My father, when he was sick, actually Dr. Sastri, Dr. Narsimhan, everyone knows my father. They used to stay behind Care Hospital. And he's very, very enthusiastic about the technology, medical, and even though he's a non-medical man, he used to be a administrative officer, accounts officer in Vijay Sauda in the combined state. And he actually usually he used to hide his illness and thinking that my travel, my efficient forming these forums, teaching will obstruct the way. That's why he never used to inform me that actually what is. Then ultimately I thought in the memory of the great man, I should do something. There are a lot of things in the pipeline, not only this CTO PCI, in his beloved memory, I want to do many things. The entire thing is dedicated to him. Next slide. So my strength is my team. Actually, there are members who are there for 20 years working with me. It's a really great thing. No family is nowadays together for more than 5-6 years. Family for 20 years is a great thing. And this is all because of the teamwork. We are doing this many forums. Maybe one of the hospital which I stayed before has done the maximum live demonstrations in India to abroad because of all the teamwork. Next slide, please. So what should I don't want to go in depth because routine heart attacks is even though they are difficult, the mortality is high. They're easy to treat. Like you pass a wire, you pass a balloon, and pass a stent. It technically may not be much difficult. But these are called a chronic total occlusions, which are there for years together, months together. They become hard blocks. Previously, people used to think why to treat them, but there's sufficient evidence. If you treat them, the chances of sudden deaths are less, the arrhythmias are less, the heart failure is less, and it will protect when there is a heart attack, it will produce collaterals. That's why people started treating. But there is no good method to treat this. All these cases in 2004-5, to my knowledge, used to be sent for surgery. But there's a big trend after 2006. Once we started these programs, we are able to treat these patients without surgery in a sutureless technique. There's a totally one approach is approaching from the front, that is antegrade, approaching from 200 microns collaterals, that is called retrograde. Next. So who needs this procedure? Very young patient, like first case I have done, is only 29 years. And he had a heart attack treated at some other hospital. He had a CTO. So he cannot go for a surgery now at 29 for various reasons. Cutting the sternum and all, that he loses the confidence in his life, quality of life. And that's why who took him up as a first case today. We finished with a antegrade technique. Like very old patients, 80 plus octogenarians, they cannot go for this vascular major procedures. We cannot use them drugs, antiplatelets very heavily, they cause bleeding. So we have to simply open the vessels, and bypass is really risky in these patients. And post bypass, patients who have undergone bypass, some of the patients who have operated recently are 44 years bypass done, and they have got the grafts blocked, then going a second bypass at younger age or older age is difficult. These are the patients. Then there are medical problems. A lot of medical problems, surgeons refuse. So patients unwilling for surgery, we do these procedures in a simple sutureless technique. Next. Next, please. So this is one of the case, young doctor actually is a pediatrician. He has got severe heart failure and the main vessel is blocked. The LED is blocked, and we opened this vessel in a technique which took nearly 2 hours. They should have kept this on the front, so sir could have actually observed. So this after opening, his pumping has improved and he is doing a normal quality of life. Actually today he has come for the OPD after 3 months. His EF improved to 55% and he's doing his practice, everything. So this is one of the classical example. Next. Next. This is a post bypass. You see, 45 years old, he has undergone a bypass. This is a bad scenario in India. So lifestyle modifications or whatever things, smoking, diabetes, and this patient has got. Okay, that is better. What I think. I'm sorry for this inconvenience. So this person at 45 has undergone bypass. Unfortunately, his grafts got blocked. Maybe he's not using the medicines or he's not maintaining the lifestyle properly, and diabetes not under control. So all 3 blood vessels, this I have done in our care Gachipoli only to help one of my colleague. We opened all the blocks, total occlusions in one sitting using less contrast and less radiation, and patient is doing good now. Hopefully modifying the lifestyle and good medication should be doing well. Next. This is another 30 years old female. It's a very surprising thing. I have done the last workshop to the NIC. She has already stented somewhere, and the stent also blocked. This is a biovascular scaffold, absorbable stent. So at 30 years, we avoided surgery and done this job, and waiting that she should do well. We will have a very close follow-up on these patients. Next. So the old lady came at 80 years, but she's well preserved 80 and doing her regular work, now suffering with severe angina and going for a surgery, family not willing and surgeon not willing, then this stump occlusion, then this vessel opened, this CTO technique. Next. Next. So there is this patient from Calcutta. He's at 33 years. I have done. He was tried in Singapore and many places. Double CTO is 34. So he doesn't want to undergo surgery at 34 years. We opened his RCA and staged. We opened his circumflex, and he's now on 9 years now, doing very good with patent stents. He came for last month, very good follow-up. These are the classical examples where this procedure helps. Next. Next, please. Thank you for the patient listening. Hopefully, I think we'll continue to do these procedures, helping many people. My idea is to form the academy is that we should do this in a cost-effective way. Most of the hardware are available in India, and patients are also willing accepting these procedures. And there should be some indigenous products, some research work to be done in this area. That's the main idea I formed this academy to help many people. Thank you all.
Thank you, sir. May I now request Dr. P.C. Rath, President, Cardiology, Society of India, to speak few words on this day.
chief guest of the evening, Mr. Sharma, distinguished dignitaries and friends. It's a noble endeavor by Surya Prakash to start this academy. He was my colleague few years back in Apollo. I know him, very focused and very skilled. Over the years, he has acquired the expertise in treating the CTOs, and any endeavor, I think he just wants to spread it out to the other colleagues so that this procedure is practiced by other cardiologists so that it's available to the mass. Very CTO is an area which is totally still a lot of work is going on. New techniques are coming, new hardware is coming. It's a very changing field, dynamic field. And this academy, I hope, will bring in all the latest knowledge, techniques, and spread it to the young cardiologist, who in turn is going to help the patient overall. And with this, I wish him all the best. I hope this academy will serve the doctor community and also society. Thank you very much.
Thank you, sir, for your wishes. Now, may I request Dr. V.S. Ramachandran Garu, President Telangana of Chapter 12, CSI, to speak few words on this.
It's a great privilege to be here at the opening of the VSP Academy, and appreciate Dr. Sharma and others, my senior colleagues, came for this function. It's not easy to train in intervention in this country. It takes a very long time. In our DM programs, we really don't get that much training in angioplasties and interventions. And even the few courses that train in interventions really don't train in complex cases. The reason why we don't get enough opportunity to train on complex cases is whenever there is cost involved, those procedures can only be done by a few operators at a few hospitals and only on a few patients that can afford them. So that is the main reason why complex coronary angioplasty is not taught to all DM cardiology students. For example, when I went to US for training in 2000, the first case that was given to me at University of Alabama, the very first case was a laser, and they let me do it fully. Now, after 20 years, we are getting laser into this country. It's not that we are not effective at doing it, it's just the cost, and that the insurance may not cover it. So people like Dr. Surya Prakash have learned their skills on the run. See, he cannot compromise his daily patient seeing. He cannot compromise his Singareni visits. So he has got to maintain his outstation visits. He's got to see his routine patients. He's got to take care of his dogs and his family. He's a full human being. In spite of that, he somehow learned in a hard manner, sacrificing so many things. Learning CTO interventions is not an easy thing. He formed those good associations, especially with the Japanese. And now that he has acquired the skills and people are referring patients from all over the country, they're referring patients to him, he can now train his students and others also through this academy. And I wish him great success. I wish his students learn CTO as well and learn to be a good human being like Dr. Surya Prakash. So that's even more important. We have to learn from his humility and from so many other things. Doctor, like others, previous speakers told about Dr. Surya Prakash. There's so many things to learn from him, not just CTO. So we hope his students learn all that. Thank you.
Thank you, sir. May I request Dr. Rajgopal Rajagaru, Senior Consultant Cardiologist, Care Hospital, to speak few words on this team.
Good morning to everybody, distinguished guests of the morning and dear colleagues. Though I have been a cardiologist for the past 45 years, but I must confess that I'm not an active interventional cardiologist. I'm more of a clinical cardiologist, though we did some procedures initially. But interventional cardiology, especially now, the present topic goes for chronic total occlusions, is a field to be very difficult field. It requires a lot of expertise and lot of patience. And all these qualities that Surya Prakash possesses. Surya Prakash is a gentleman to the core. Most of you doesn't realize that he is around also. He's such a silent worker, all the time doing the procedures and guiding the juniors. And to start a program like this, and it requires a lot of experience and dedication, and which I'm sure Surya Prakash possesses. Surya Prakash, wish you all the best, and it will be a great opportunity for the youngsters who are working with you and also the others who are likely to follow these programs. All the best, Surya Prakash.
Thank you, sir. Now, may I request Dr. B.K.S. Shastri, sir, Senior Consultant, Cardiologist, to share a few words.
Respected chief guest and other distinguished members, good morning to all. I'm very glad that Surya Prakash has started this program. Many people don't realize that the medical profession, teaching is as much part of the medical profession as service. And people like Surya Prakash exemplify that teaching is part of the medical profession and it is second nature. I've been observing for him for many years. And past 1 year, I have been working with him. It is very great pleasure to work with him. He is very helpful many times without any hesitation and guides. And of course, as mentioned, he is very hardworking. Without hard work, this much of accomplishment is not possible. That speaks for itself. And I'm glad now that he has started this program to share his knowledge. It's a wonderful program. I wish him all the best. Congratulations, Dr. Prakash, and best wishes to you.
Thank you, sir. Now, I would like to call Dr. Nikhil Mathur, sir, Chief Medical Services, to share a few words on this team.
Good morning, one and all, and it's my privilege to address this gathering. Cardiology over the years, as we all know, has grown multifold, and what we would never imagine doing 10, 15 years back, today people do it with ease, the interventions. And that is because of the skill of the cardiologist as well as the cutting edge technologies what we have. I'm sure this academy started by Dr. VSP will give everyone a platform where they can refine their techniques, they can exchange knowledge and collaborate so that at the end of the conference, everybody has an answer to a complex angioplasty. Starting this academy speaks immense about you. It's just not about performing procedures. It's also about disseminating knowledge and training young guys and also colleagues in difficult interventions. So it speaks immense about you, sir. So very proud to have you at CARE as one of the senior cardiologists here. I request all the participants who are there to just participate well. Let it not be just a one-way communication, but put it two ways. No question is small or big. If you have doubts, please ask and use this program to its fullest. I'm sure this is going to be a great academic feast and a great success in future, and best wishes from my side to you, sir. Thank you.
Thank you, sir. I shall now share a quick introduction of our chief guest, Sri Sunil Sharma Garu. Sri Sunil Sharma Garu, a seasoned bureaucrat of the Indian Administrative Service, brings a wealth of experience to his role. Graduating with an MBA and having completed his schooling at St. Joseph College in Allahabad, he joined the IAS in 1990. His career has seen him hold a range of significant positions, including District Collector in Prakasham, Visakhapatnam districts, Commissioner of Municipal Administration and Agriculture Department, and Secretary of Government in departments such as Infrastructure and Investment, and Secretary to Government in departments Women Development and Child Welfare, Transport, Roads and Buildings. Currently, he serves as the Chief Secretary to the Government in Telangana Energy Department, showcasing his dedication to public service across diverse sectors from rural and urban development to women and child welfare. I now request our esteemed chief guest, Sri Sunil Sharma Garu, to share words of wisdom to us.
Thank you. Respected dignitaries, Dr. Surprakash Rao Garu, all the doctors, the cameraman, the comparer. A very good morning to everybody. It is indeed a very happy occasion where Dr. Surprakash Rao has started such a noble program today that speaks volumes about it. Because see, a technique or a procedure which you have, you are sharing with others. It's a great thing. You don't want to confine it to yourself. You are sharing with others and also taking others' experiences and seeing that the entire society benefits out of it. Doctors today in all fields and especially cardiologists, I mean, we can tell that they are gods. God has sent you in the form of God to this earth because you save lives. God gives birth, but you prolong the life. You give life to a person who is about to die. That is a very, very noble thing which you do. And we have seen many people who are about to die were saved by you, by your timely intervention and the right technique which you have used. And with minimal intervention, we have seen that the person becomes totally perfect. Very recently, a gentleman who was known to me from Visakhapatnam was referred to Dr. Surprakash Rao, and he went back so satisfied. Apart from the treatment which he got, the medicines which are prescribed, the way he was explained by Dr. Surprakash Rao, and the confidence which was given to him made him feel, 30 to 40% of his treatment was because of that only. That is also very important. Because the confidence which you give to the patients, that really makes a patient feel very nice. And we are really grateful to all the doctors who are doing great service. And all of us at any point of time in our life need a doctor. And when we go to a doctor, we realize, otherwise also we realize, but when you go to a doctor, we realize how important he or she is to us. So all I can say that this academy, which is being started, or we can call it a seminar, academy, whatever name, but it is a very, very good interaction. And I suppose it's a webinar sort of, others also participating from outside, everybody will benefit. As you said that today the technique has improved. So this technique also, with this, so many people can benefit out of it. And later on through the social media also, you can educate so many people to see that they know about this program. So I'm really today touched that I was called for this such a noble program. I am a part of this noble, not technically, but just being present here, I am a part of it. I feel very nice about it. I feel very touched about it that you have called me. And whatever way I can be of any use to you, I'll always be there in the capacity of an officer or in the capacity of a person, human being, whatever capacity, I'll always be there. And I wish you all the best. And I feel that, I'm very sure that this will be a great success and it will help in disseminating the knowledge to so many other doctors and also saving so many other lives in a better way. Thank you so much. Thank you.
Thank you, sir, for your kind words and warm wishes. Now I request Dr. V. Surya Prakash Rao, Head of Cardiology Care Hospitals and Course Director for the VSP Academy, to felicitate our Honorable Chief Guest along with our Group CMS, Dr. Nikhil Mathur, sir. Sir, on the dais, please. I also request our head CEO, Nilesh Gupta, sir, to join the dais. I also extend this greetings to Dr. Rajgopal, sir, to join. Please, sir. Thank you. Thank you, sir. I request Mr. Nilesh Gupta, our Hospital Chief Operating Officer of Care Hospitals, to please give the vote of thanks.
Good morning. On behalf of Care Hospitals, I would like to express our gratitude for all of you being here. Our special thanks to our chief guest, Sri Sunil Sharma Garu, the distinguished cardiologist which we have with us here, Dr. P.C. Rath, Dr. Ramchandra, Dr. Rajgopal Raju, Dr. B.K. Sastry, Dr. V. Surya Prakash himself, and Dr. Nikhil Mathur. Thank you all for being with us here. Those who are there online with us and attending this program, I express our vote of thanks to them as well. And all our consultants who have spared their time and are part of this program. Thank you so much. Sir, we wish you really all the best. And we are quite confident that this will be something which people will remember. And this will be a great platform for dissemination of knowledge for the techniques which are not usually available for people to learn. So best of luck, sir. And thank you so much for being here.